change is afoot for health care coverage for millions of people after the U.S. Supreme Court made its decision on the Affordable Care Act. Many Americans have choices to make, like picking a provider. Currently, it's estimated 85% of Americans have some sort of health coverage. Now, under the act, that goes up to 92%. What decisions do these people have to make? Emily Guggenmuss has that story tonight.
With the ruling of the new Health Care Act, many are wondering how this will change health care for them.
Many people will not be affected. That is, folks who already have employer-provided care. Much of that will not change.
Those who don't receive benefits through their workplace will be able to shop for their options at an exchange.
That health insurance exchange will be essentially a huge marketplace where all the various insurance products, including Medicaid, will be on display.
Tony Siegel, a professor at the UB Law School, says the process is meant to be easy.
The design of it, at least suggested by the law, is that there be a lot of consumer assistance, that the products explain their benefits in plain English.
Siegel says much of the logistics still need to be determined, but insurance companies will now have limits on how much money they can keep from premiums. And although we don't know how much the policies will cost, experts say there will be different tiers of coverage. But if you choose not to have insurance, there will be a penalty.
What made it into the law was a penalty of $695 a year.
Liaison is a private exchange for businesses, but in 2014 will also offer individual plans.
The area the government's certainly targeting the most are those who can't afford it today by offering subsidies.
But what about those the government doesn't consider poor?
Subsidies are available for households that make even up to $90,000. So there will be subsidies available for those who, are not necessarily poor, but are folks who, may feel pain today for the cost of health insurance.
Emily Guggenmuss, News 4.
With the new law, there will be new requirements for small businesses, and Emily will have more on that at 6. Insurance providers are discussing the changes that will result from the Affordable Care Act, and Don is here with that. Don?
Diana, now that Obamacare is the law of the land, at least for now, Blue Cross Blue Shield of Western New York held a forum today on what the Affordable Health Care Act will mean for medical care for the people of Western New York. I had the privilege of serving as a moderator for the panel that was made up of local experts and leaders in the healthcare field. The Supreme Court decision upheld an insurance program for most Americans. There are many facets to this law. Medical experts don't expect it to decrease costs nor enhance the quality of medical care. But it should stop people without insurance from depending on emergency rooms for basic medical care.
People in the community that go to the ER with no insurance so they can be seen for an earache or a toothache. And that's because they don't have any insurance, so they know the ER will service them. So what do you do with those people? Because we're spending millions of dollars on people that if you paid a couple of hundred, we can see you, triage you, and get you out.
And with millions of Americans expected to get health insurance now, doctors are predicting it will lead to a shortage of primary care physicians. Medical experts say that's just one of many issues the new law will create. Diana?